I'm the Fox Medical Team's Beth Galvin in the Digital Center for a Facebook Live talk back with Dr. Ibrahim Adamu. He is a colorectal surgeon with Piedmont Healthcare, who is going to be joining us this afternoon for the next few minutes to kind of talk about colorectal cancer, what you need to know, what the warning signs are, what your risk factors might be for that, and what you can do to lower your risk of developing colorectal cancer. And Dr. Adamu, thank you for joining us this afternoon. I really appreciate it. Can we start off, if you don't mind, talking a little bit about what colorectal cancer is and why it's really an issue in this country? It's the fourth most common cancer in this country.
Yeah, thank you for having me. Colorectal cancer, as you put it, is cancers of the colon and rectum, which is just one long tube at the end, starting from the end of the small intestine all the way down to the rectum, where it joins the anus. So colorectal cancers are a big deal, especially in North America, because if you exclude lung, prostate, and breast, this ends up being the next cancer in terms of prevalence. And in fact, it's the second leading cause of cancer-related deaths in America.
Well, let's talk about that a little bit. Why is colon cancer often, a killer? You know, is it that we're not catching it early enough, or what is the issue there?
Yes, that is a good question. Most people, the data suggests that at least 1/3 of all people who are supposed to be doing what they need to do to prevent colon cancer or to catch colon cancer much earlier in the stages are not doing it. So
what are we talking about? What are they not doing?
So we're talking about colon cancer screening. Unlike breast cancer, where there's a lot of embarkment on screening, colon cancer screening has still not got the same degree of attention like in the case of breast cancer.
And when we talk about, if you're just joining us, we're doing a live, Facebook Live session with Dr. Ibrahim Adamu. He is a colorectal surgeon with Piedmont Healthcare, talking a little bit about colorectal cancer. And when we talk about screening, why is there sort of this resistance to get screening, and who really needs to be getting screened?
Right. Overall, the awareness is increasing, but the vast majority of times, I think most patients are put off from the bowel prep. They do not want to go through the cleansing process that is needed for the most common and the best tool we use for colon cancer screening, which is colonoscopy. But in general terms, who should get screened, we say is based on your risk factors. Okay, the average person needs to start colonoscopy at the age of 50. Okay, who is average risk? Anybody who is 50 years old without a personal history of colon polyps or a family history of colon cancer, does not have any diseases like Crohn's disease or ulcerative colitis, or does not inherit any colon cancer related gene, is said to have average risk. Now, these people, we recommend that they start at the age of, these average risk people will start at the age of 50, and if they are found to not have any polyps, should go on to have colonoscopies every 10 years. So starting 50, every 10 years. When do we stop? Most people tend to stop at ages 75 and 80, but really we want to individualize the upper limit. You want to individualize that in the sense that you have to put into perspective the person's life expectancy. If the person's general health is not so good and you don't expect more than 5 years of survival anyway, there will be no point in treating the colon cancer. However, for instance, grandma is 80 and she still enjoys life. She goes around by herself, and chances are that if she were to have colon cancer, you will go ahead and treat it. Then grandma will benefit from colon cancer screening.
And if you'd like to leave a question for Dr. Adamu, if you'd like to ask him a question, leave a question in our comments section, and we'll try to ask your question for you. When we talk a little bit about getting ready, the prep for the colonoscopy, what does it basically involve, and and what can you kind of expect when you're going for your first colonoscopy?
Generally, we have to clean the bowel because stool gets in the way of the visibility. You want to be looking at the clean surface of the inside of the colon, not the stool.
Yeah.
So people generally will start bowel prep late in the afternoon, and the day before the colonoscopy, we recommend they maintain only liquid diet. And then the midnight, they don't let them eat after midnight, and the following morning they come for a colonoscopy. Now that means that they have to frequent the bathroom in the early hours of the evening and sometimes late into the night, and that is very discomforting to a lot of people. And they have to come to the hospital and get some form of anesthesia for the procedure to happen, and somebody has to drive them back home.
So it's a commitment.
It's a commitment that.
Why would you really push people to do it, though?
It is important, like we talked about. It is a very prevalent situation. Colon cancer is real. It's very common, and if you find colon cancer through screening, the chances are much, much higher that this is going to be a low stage. Okay, that means you're catching it much earlier in the process, and then you're giving yourself the best chances of surviving or getting the best treatment and the best survival from this colon cancer. Whereas when you catch it in the late stages, the chances are pretty much grim.
Yeah.
And that is why, exactly, that is why we push for screening. And more so, before we even get to screening, I want to just talk briefly about what we can do to mitigate our own risk. Why is colon cancer not so high in other cultures, but a lot higher in the Western Hemisphere? Most people believe that sedentary lifestyle and a lack of exercise, high fat, low fiber diet, increased consumption of alcohol and smoking, along with some genetic factors, play a big role. So age, genetics, and lifestyle do play a significant role. And
so the flip side, and if you're just joining us, this is Dr. Ibrahim Adamu. He is a colorectal surgeon with Piedmont Healthcare, talking about colorectal cancer. So if we talk about the reason why it's prevalent, our diet, our lack of exercise, smoking, other risk factors, weight, being overweight, we all struggle with those issues. What can we do to lower our risk of developing? I mean, what are lifestyle changes we could start making today to lower our risk of developing colorectal cancer?
Right. So diet that is rich in high fiber, we recommend generally fiber about 20 grams or more daily intake, and eating a lot of fruits and vegetables. Okay, it's really good. Exercise and keeping the weight within the normal BMI levels, quitting smoking or not going into smoking at all, and decrease the amount of alcohol consumption as much as possible are things that we can do. And for those people that are, actually have non-modifiable risk factors, like those with Crohn's and ulcerative colitis, there are steps you can take to prevent or catch colon cancer in the very early stages, including those with genetic who have inherited some genes that predispose one to having colon cancer. So these folks need to have colonoscopies much earlier and need to get colonoscopies also more frequently than the average person.
We're getting some questions on Facebook. Crystal asks, is constipation a symptom for younger people if a grandparent, say, died from colorectal cancer? Is that something that should be on your radar? And maybe you could just kind of use that as a stepping stone to talk about other warning signs.
Right. Constipation can actually be a warning sign for colon cancer, especially in somebody who has advanced age. In general, we say that any recent changes in bowel function could be a warning sign of colon cancer. I'd like to mention that, by the way, the vast majority of colon cancers do not give warning signs until it is in the late stages.
That's why the colonoscopy
That is why
so
screening and colonoscopy is very important. So the risk factors for constipation tend to go alongside the risk factors for colon cancer. And colon cancer can, in fact, cause constipation. So I don't know how old, is it Crystal?
Yeah, it's Crystal.
Crystal, I don't know how old you are, but your grandmother's history of colon cancer may not really put you at a higher risk, because that is not a first-degree relative. That is a second-degree relative. You will have to have 2 or more second-degree relatives having colon cancer to actually put you at a higher risk. Otherwise, you still be considered average risk.
So if, say, my father had colorectal cancer. What should I be doing now? You know, if I'm not yet 50,
right.
What kind of steps should I be taking, or my
Right.
mother?
So, your father, that is a first-degree relative. We recommend getting a colonoscopy 10 years earlier than the age at which your father got the colon cancer, got diagnosed with colon cancer. It is more important when that colon cancer occurred at the age less than 60 years of age. Okay, if your father got it before he turned 60, it makes it even more. Colonoscopy starting at the age of 40. So 40 years is when we recommend. But if your father was 80 when he got colon cancer, that probably doesn't play a lot into giving you any high risk.
If you have a question for Dr. Adamu, who is a colorectal surgeon with Piedmont Healthcare, leave it in our comments and we'll get to it. Doris is saying something I'm sure you will agree with. She says colon cancer is serious, screening doesn't hurt.
Right.
And I think that's maybe a point we didn't make.
Right.
You talked a little bit about being placed under sort of, is it a twilight anesthesia?
Right, right. Generally, you go under anesthesia. It's a procedure is fairly safe. It's a fairly safe procedure. It doesn't, for most colonoscopists, it takes about 15-20 minutes to get a colonoscopy done. And people wake up feeling like nothing really happened. Most people describe it as the best sleep they've ever had. And they go back. The complication rate is very, very, very low. Mm-hmm. It's possible to have complication with anything, but the complication rate is very low. And it is not as bad as many people think. Okay. It is not as bad.
Charles is asking, is IBS, irritable bowel syndrome, related to colorectal cancer?
I would not link IBS directly to colon cancer, but it's possible that some of the symptoms or some of the risk factors of IBS could also play a role in causing colon cancer. But there's no direct relationship between irritable bowel and colon cancer.
Okay, we have another question for Dr. Adamu. He's a colorectal surgeon with Piedmont Healthcare, answering your questions. Put them in the comments section, please. Angia asks, what foods should I eat?
Foods that are high in fiber, fruits, apples, oranges, eating grains, non-processed food. Mm-hmm. Fried foods should not be your best friends because those contain high amount of fat. You want to make sure that you decrease your consumption of red meat, which is also associated with colon cancer. In general, these are the basic steps you can take to mitigate your dietary risk and keeping your weight under check.
So you see colorectal cancer all the time, Dr. Adamu. What do you eat?
I try to eat normal. I try to eat a lot of fruits and vegetables. I try not to eat as much processed food. If I go to the store, I try to buy many potatoes, and I eat the potatoes with the peel. I do not peel everything off before cooking it. Mm-hmm. And I do not just eat because I think the food is good. I eat when I feel like I need to eat, and I need the energy, not just keep eating until I can move, which is sometimes what creates the problem. Yeah.
We have another question here from Anja. She says, does a barium enema show colon cancer?
Barium enema used to be one of the recommended screening methods. It has sort of fallen off of the choice. The colon cancer or colon polyp pickup rate is not very high, and we generally put it very, very, very low down the list of screening methodologies that we have. We put colonoscopy. There are a whole lot of other screening methods that have come that we can go into later, but barium enema will not be my preferred choice of colon cancer screening. It's in times when somebody cannot get a colonoscopy and some of the other screening methods are not available that will resort to a barium enema.
So your go-to would be
colonoscopy.
One thing I wanted to ask you, and if you're just joining us, we're live in the Fox 5 Digital Center with Dr. Ibrahim Adamu. He is a colorectal surgeon with Piedmont Healthcare, and you can ask him your questions about colorectal cancer, or about IBS, or anything else you want to ask him in our comment section. We're trying to get to them. That's why I'm looking at my phone. Marissa's asking, how can I maintain IBS?
To answer the question, IBS is a particularly notorious disease, irritable bowel syndrome. it's a diagnosis of exclusion, which means that nobody totally understands what IBS is, and it comes in various forms. Some have diarrhea, some have constipation, and some have a mixture of diarrhea and constipation combined. Now, this is a case where I will think that you have to work closely with your GI doctor, work closely for him to identify your symptoms and signs and see which variant you have. And there are some modalities that could be tried, including the use of certain medications.
And talking a little bit about some of the warning signs, if I develop something like blood in my stool,
Right.
At what point should I become concerned?
Any blood in the stool, particularly in anyone over the age of 40, should be taken seriously, because any cancer low down in the GI tract can manifest as bleeding perirectum. And I have to say that whenever we find rectal cancer that is way advanced, or even anal cancer that is way advanced, it's often because it has been mistaken to be a hemorrhoid and treated as a hemorrhoid for a long time, only to realize that it is not succumbing to the hemorrhoid treatment. Then it gets tested for cancer, and then we find out that we find a colon or rectal cancer at later stages. So all forms of bleeding perirectum should be taken seriously. At the very least, if you are about 40 and you have bleeding perirectum, you should be examined to make sure it's not from benign disease like a hemorrhoid or a fissure or some other form of bleeding that is high up in the GI tract. But a colonoscopy or a talk with a GI doctor or a colorectal surgeon will not be a bad idea in this sense.
So if I go for my colonoscopy and I have a polyp,
Right.
or what else are they looking for? What other kinds of things are they looking for? And then what's next for me if they find something that looks abnormal?
Right. So the goal in colonoscopy actually is to find polyps, remove these polyps, get them tested, and if these are the precancerous ones, get rid of them and put you on a surveillance plan where you get screened more frequently. Once you have polyps, the most you should go on is every 5 years. Every 5 years, you should get a surveillance colonoscopy to look for any new polyps that are developing, get rid of them before they turn into cancer. But the goal here is to find polyps. The goal should not be to find cancer in screening, because we're trying to prevent development of cancer.
So if they see polyps, that just means that they're going to need to look at me. They're going to need to study what that polyp is, take a closer look at it, and then they're going to need to keep a closer eye on me.
Right, correct.
But it doesn't necessarily mean I have cancer.
Right. It doesn't necessarily mean you have got cancer. And even there are some polyps that may have cancer in them, and if they're really early in the stage of the cancer and they are in certain locations of the polyp, just removing the polyp may be all that is needed to be done.
Okay, and Sean is joining us and asking, and we kind of went over this a little bit before, Dr. Adamu, but maybe you could touch on this. Who's most likely to get colon cancer or to develop colon cancer?
Who is most likely to get colon cancer? We have some people that have inherited some genes. For instance, those who inherit what we call the familial adenomatous polyposis gene. We know for sure that 100% all these people are going to get colon cancer by the age of 40 or 50. Fortunately, this doesn't represent most of the colon cancers. In fact, less than 5% of all colon cancers are due to genetics.
Okay.
And only about 15% of them are run in families. So that means that the vast majority of colon cancers are sporadic, meaning they just come out of the blue. You don't have it running in your family, and you do not inherit any bad colon cancer gene. So who should be worried? Anybody above the age of 50 should be really worried about colon cancer and should be screened for colon cancer. But if you are having bleeding perirectum, if you are having a change in your bowel habits, you've gone from diarrhea to constipation or vice versa, or you feel bloated, you have weight loss, abdominal pain, or for some reason they found that you are anemic, even though no bleeding source has been found, those could be warning signs of colon cancer.
And John asks, Dr. Adamu, what determines a 5-year plan versus a 10-year plan?
You're talking about colonoscopies,
we're
right?
talking about colonoscopy,
Right.
I think.
So the 5-year plan will be for somebody who is considered at increased risk.
Okay.
That's somebody who has a history of colon polyps in the past, or probably has a strong family history of colon cancer. That is a first-degree relative with colon cancer. They go on a 5-year surveillance.
So which means every 5 years
Every
they
5 years they need to have it.
Yeah.
And the average risk person gets a colonoscopy every 10 years.
Okay.
That means somebody who does not have Crohn's or cerebral colitis, does not have a colon cancer gene, and does not personally have a colon polyp, colon cancer, or does not have a first-degree relative having colon cancer or colon polyp.
Do you see, or are you seeing a trend of younger patients developing colorectal cancer? Because I know there have been some studies that have been showing sort of inexplicably these younger people developing who are healthy weight, healthy lifestyle. What do you see? Are you seeing this trend?
Yes, that's right. I mean, in fact, we are seeing more and more people develop cancers before the screening age, in their 40s, and that makes people wonder whether we should actually lower down the screening age from 50 to 45. I think there are a few studies going out there that screening at 45, at the age of 45, may actually benefit the population more than 50. Yeah, but at the moment, the consensus by almost all the societies say we should start at 50. But we do know that we are seeing more and more of colon cancers present at early stages. That is before the age of 50.
Okay. And just talking about a little bit about changes that you can make to lower your risk. I mean, if you could just suggest 2 or 3 things to people to get started on, what would you say, Dr. Adamu, about, kind of trying to get your risk as low as possible of developing this?
I will say diet, high fiber, low fat, decrease red meat, decrease alcohol consumption, and smoking. Of course, if you do this and you exercise, your weight is going to be in check. Yeah. So you would have pretty much attained 4 or 5 of these risk factors by just targeting the diet exercise factor. Diet, exercise, smoking, alcohol puts a lot of these risk factors away. Okay. Yeah. The U.S. Preventive Services Task Force also recommends using aspirin as a way of lowering one's risk for getting colon polyps or colon cancer. That is not really being enforced by all societies, but as a matter of fact, most people above the age of 50 are on low dose aspirin anyway for heart health and for preventing stroke. So it doesn't hurt. It seems to help in the prevention of colon cancer and may actually benefit some people that already have colon cancer. But you have to discuss that seriously with the doctor because the risk of bleeding also can exist with aspirin.
Okay, we're going to wrap up pretty soon with Dr. Ibrahim Adamu. He is a colorectal surgeon with Piedmont Healthcare, but if you'd like to go ahead and leave a question now in the comments section, and we'll try to get to it in the next 5 or 10 minutes. Sean is asking, the flip side, are there any medications I should stay away from, maybe if I'm at elevated risk for colon cancer? Is there anything that's problematic or?
Not that has been studied, not any medication for sure that has been studied and identified to cause colon cancer. The risk factors are pretty much what we mentioned, just random age, about 50, history of obesity, low fat, low fiber, increase in consumption of red meat, sedentary lifestyle, obesity, and smoking and alcohol. But other than that, we haven't established any chemical agent or any medication per se that we say increases somebody's risk for getting colon cancer.
And what's a good limit on red meat?
Just decrease as much as possible. We have so much. I don't think I have any particular quantity in mind, but just enough to keep your iron levels normal. But most of the time, we realize that we are probably eating about several folds, about 10 to 15-fold more red meat than we should be eating.
And somebody asks, and I don't know whether this is just in colorectal cancer in general, or maybe this is colon health in general, but what about probiotics?
Probiotics have not been shown to decrease colon cancer. The general understanding here is that they don't hurt. It doesn't hurt to be on probiotics, but the evidence in support of probiotics preventing colon cancer is lacking.
Okay. And finally, Dr. Adamu, if I have a colonoscopy, they find something, what's next for me? I mean, if they find something that looks like it's cancer, not they're going
Right.
to watch me?
So
What can I expect?
if it is cancer, and I like, thank you for asking that question too. Most people don't get colonoscopies because of fear of something being found. The answer to this is yes, colon cancer can be treated. It can be treated, and the survival is actually greater than the survival of most other cancers. So we have, once something is picked up in colonoscopy, you wait for the pathology report to come. And if it is confirmed to be cancer, we have to now do studies to investigate how far the cancer has gone. Is it stage 1, stage 2, stage 3, or stage 4? And then we have a multidisciplinary team made up of surgeons, radiation oncologists, medical oncologists, for the most part, medical oncologists, that come together to assist in the treatment of colon cancer. But you may need to have surgery. Most likely we need to have surgery to remove that colon cancer. And I like to mention here that having colon cancer surgery doesn't always mean having a bag.
Right.
Does not always mean having a colostomy,
Right.
which is what people are afraid of.
Yeah, and if you can get the colonoscopy, then at least you know, and then you have options. Because
Right.
if you wait,
Too late, and it may be too late, and the survival and then the lifestyle are not going to be anything close to when it is caught in the early stages.
and the irony being that often colon cancer is a very slow-growing cancer.
Right.
So there is time, but
There's
you got to
time.
get the screening.
You got to get it. I mean, the average, we stipulate that on the average it takes about 5 to 10 years for colon cancer to develop and manifest. So we have the time. The time is there for us to do the screening and keep things in check.
Do you have a hard time with your own family getting them to go in for their?
Everybody, including doctors.
They don't want to do it either?
Including doctors.
Yeah.
We say doctors don't have doctors.
Yeah, yeah.
But and that has, so the reluctance to get a colonoscopy has brought up some of these other alternatives for colon cancer screening. We know in the last few years they've rolled out Cologuard, which is
So Cologuard is a stool DNA
right.
stool test that you
Right.
do at home.
Right.
You send it off to the company,
Right.
and then my doctor would get the results and
get
then
the
give the
results.
results. What do you think of that?
Right. So the idea sounds appealing. It sounds great. You don't have to go to see the doctor. You sit at home and you just parcel some stool, send it away.
Yeah.
It's true. It is able to detect colon cancers. They say sensitivity is probably over 90%, around 92% sensitive. The downside of Cologuard is that it has so many false positives.
Oh.
Anywhere from 13 to 15% of these tests that come back positive actually end up having nothing when you do a colonoscopy. The second downside is if something is found with Cologuard, then you have to follow that up with a colonoscopy.
So you're going to have to get it
You
anyway.
don't have to get a colonoscopy anyway.
Right.
So what do we do with and then the dilemma here is, what do we do with people that have a false positive test from Cologuard? We still do not have a consensus about that.
Right.
So most people are saying those patients fall into the average category of risk. But the anxiety and between the doctor and the patient just pushes people to get even a colonoscopy every 5 years, because now an alarm bell has been has gone off.
Yeah. Yeah. Well, I want to thank you so much, Dr. Ibrahim Adamu, for coming out today and for
Thank
talking
you.
to us and doing this Facebook Live, talking about colorectal cancer. It's the 4th most common cancer in this country, and it affects about 1 out of every 20 Americans at some point in their life, men and women. So it is common, it is real, and unfortunately, it's often not found until it's very late in the game, because people don't want to, as you were saying, go
Right.
through the screening process, which has gotten much better. But I want to thank you, Dr. Adamu, for making the time to do this, and I want to thank you all for your great questions and for joining us for this Facebook Live from our Fox 5 Digital Center. I'm Beth Galvin. We'll see you soon.
Thank you.